Do you know that the #1 factor for admissions in the government and private hospitals are cough, cold, and asthma? All of these are thoracic-related medical conditions that involves both the lung and the heart. I'm Mohamed Ezani. In today's Heart News, we will take a look at one of the few highly specialized thoracic care centre here in Institute Jantung Negara. IJN has now consolidated a complete medical team of thoracic experts to offer various treatments and services for all sorts of heart and lung complications. According to IJN Private Healthcare Division, Head and Director of Operation, Dato Dr. Mohamed Ezani Mohd Taib, the Thoracic Centre, which focuses on the overall chest health, is well equipped with comprehensive imaging service facilities to correctly diagnose the patients and decide the best treatment options. And in the middle of COVID-19 pandemic, the centre has also rolled out post-COVID-19 package for those who were infected by the disease and have recovered, given that outbreak disease affects the lung.
And IJN, being a major centre for thoracic services, felt that it is important for us to combine all the resources that we have, and especially with the allied health services that includes dietitian, physiotherapists, and use these people to assist patients in having the best care possible in thoracic medicine. The services that we offer ranges from for respiratory medicine right up to advanced surgery, okay, and including rehabilitation or pulmonary rehabilitation services.
Some of the diseases that can be treated at this thoracic centre are hyperhidrosis, commonly known as excessive sweating, and pectus excavatum, or sunken chest, among others. The centre has several non-surgical and surgical options to effectively treat the disorders.
Well, hyperhidrosis, actually, there are two types of hyperhidrosis. One is called primary hyperhidrosis, and the second is secondary hyperhidrosis. Primary hyperhidrosis occurs when there is excessive sweating, right, to the individual. That means the hands and the legs, especially the foot, become very wet with sweat, and sometimes the axilla. So this is caused by an abnormal activity of the nervous system in the person itself. We offer treatment for this, the surgical option for the treatment, in which actually the treatment is removing some of the nerve tissues within the chest, and this will stop the excessive sweating by about 99%. Sleep apnea actually is when the patient stops breathing when they're sleeping. They snore loudly, and after a few seconds they will suddenly breathe again, and as a result of that, they don't actually get a good sleep. The treatment actually is first to identify whether they are actually suffering from sleep apnea by undertaking a sleep study. We call it a sleep study. It can be either a home sleep study, in which the machine is put at home and they have they are assessed, they are sleeping assessed, or they get admitted and we do an inpatient sleep study. The Thoracic Centre can cover almost any thoracic problems within the chest except for the esophagus, which is the eating tube that we have, right? But for the airway itself, or the trachea, the lungs, the heart, anything within what we call the mediastinum, sometimes there's growth inside the chest itself, we are inshallah able to treat.
Institute Jantung Negara has been at the forefront of thoracic surgery since its inception, and it is the only centre that performs lung transplantation as well as conducts surgical treatments for end-stage lung diseases. I'm Mohamed Ezani. Thank you for watching Heart News. Stay safe and don't forget to subscribe.